If you're planning on starting a new physical activity or ramping up your current training routine, you could be at risk for an overuse injury. An overuse injury is any type of muscle or joint injury, such as tendonitis or a stress fracture, that's caused by repetitive trauma. An overuse injury typically occurs when you take on too much physical activity too quickly. The specialists at Tri-County Foot and Ankle see all types of overuse injuries in their active patients. We checked in with the specialists there to find out about some of the most common causes of injuries that keep their patients out of play.
One of the most common things that I end up seeing with the practice is overuse sports injuries. People are living longer because of advent of medicine and progressive health factors, and now since we're living longer, we're making our bodies work more for us. So we see things like overuse injuries, which you're chronically kind of pushing and pulling on tendons and bones, and it's not something that happens spontaneously out of nowhere, it's something that kind of builds up. And a lot of patients will come in, they were like, I was doing just fine, last week, and then it started nagging me, and I thought I could walk through it, or I thought I could play through it, and then it just kept getting worse and kept getting worse and getting worse.
Everyone thinks, oh, that pain will go away, that pain will go away, but foot pain is a warning sign something is happening. So the more you ignore it, usually the problems will accelerate or get worse, and so if you have pain, it's not normal. I'm here to tell you that it's not normal. So you really need to get it addressed and prevent other problems down the line. One of the most common injuries we see in the office is plantar fasciitis, where the ligament on the bottom is basically inflamed. Patients don't realize that and think, oh, I stepped on glass, or something abnormal happened, but it's really an overuse injury. And patients need to recognize that you're doing too much and your body's not used to it and you need to rest. So there's no magic shoe, there's no magic support. You really have to address what's causing the problem to cure the problem. One major problem patients have is Achilles tendonitis, and that's from not stretching enough. Everyone tells you to exercise, 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 but no one really emphasizes stretching. Stretching is an imperative part of good foot health. When you don't stretch, tendons get shorter, they'll start to pull, possibly even tear. So over the years, if you don't stretch it out, it's gonna form micro tear, and then one day you're just gonna rupture it, and then you'll need surgery, and it just starts a whole problem. So preventative medicine of stretching every day, and especially the more active you are, the more you wanna stretch. One important stretch is really stretching your calf muscle. Just isolating your calf muscle, stretch at least 10 minutes a day, and it really helps prevent the fibers that are wrapping around and being continuous with your plantar fascia. So the two ligaments, the plantar fascia and the tendon, the Achilles tendon, are related, and if you stretch both out, you'll help your overall foot health. One other diagnosis we see quite often in the office is shin splints. So patients come in complaining, oh, my legs are achy, it hurts right along my shin bone, and a lot of times that's just from not having enough support or wearing shoes that are not shock absorbing enough. So a lot of patients in Florida like to wear sandals, obviously. So if you do that repeatedly, the foot sometimes cannot hold up your body weight, and the shock goes up through your foot into your leg, and that causes the inflammation along your shin bone, which we call shin splints. Stretching your calf muscles can often prevent shin splints, because when the muscles are tight, they tend to pull on the bone, and that causes inflammation. So if you stretch it out, you should be able to prevent a lot of that pulling, a lot of inflammation, and it won't press on the nerves.
Listening to your body is a huge portion of a patient's home and health care, whether it be foot, ankle, anywhere else in medicine, honestly. Knowing yourself and knowing when something isn't quite right and seeing the right person in the right amount of time before it gets too bad. Rather than trying to wait to see if something clears up, it's a really quick appointment. You just make it, you come in, you get some peace of mind, and then you're back on your feet again, hopefully sooner rather than later.
You'll find information for Tri-County Foot and Ankle when you click the Overuse Injury story link icon online at yourhometownhealth.com.